Hi, so today I'm talking about the role of charge nurses in the hospitals, and I'll specifically trying to bring out a big picture of what the charge nurses have to do, and also the qualities that the charge nurses should have to succeed in the position. And hopefully, most of you will be interested in taking up the challenge. Thinking of becoming the charge nurse can be intimidating because involves a lot of responsibilities, and what may come to some of the people's mind is that, oh, I'm going to be so overwhelmed with stuff, just like the nurse who's being shown up here in the picture. She's receiving a phone call, the doctor is asking something, she has to finish up so many assignments. So that's what we are going to be looking at. We'll begin by looking at the things or responsibilities for the charge nurse. One is making assignment. Charge nurse is responsible for making sure that he or she align the skills and abilities of different nurses with uh, different patients. That's making the appropriate assignment. And also he or she serves as a resource for other nurses. By serving as a resource, the charge nurse ensures that he or she provide the skills or the assistance to the nurses who may need as help on the floor. And also, the charge nurse is responsible for delegating different tasks as a way of maximizing the available resources on the unit. The charge nurse is also responsible for resolving conflicts among workers and also promoting patient-centered care. Now, we should think about what are the qualities that could make the charge nurse be able to perform all the functions or the roles that we've talked about. It's really a big challenge, and you really look like the boss for all other nurses. And that's why you have to have the qualities that will make you to be successful in your role as the charge nurse for a given unit. The scheduler should have excellent team player skills to ensure that all members on the unit function as a team to achieve the goals of the unit. And also, the scheduler should have excellent leadership skills to ensure that the guidelines and standards are followed by whoever works on the unit to achieve the best and highest quality of patient care. Yeah, the child nurse should have excellent communication and interpersonal skills. This will allow uh, whoever is serving in that position to be able to provide good directions to the staff or be able to communicate with family members. And also, this skill can allow the child nurse to resolve um, disputes between co-workers which may come up during the shift. Planning and coordination is another skill that the charge nurse should have. Why? Because usually the unit may have limited resources or limited skills, and that's why the charge nurse should plan ahead to be able to balance the skills when making assignment and be able to provide appropriate uh, personnel with the skills to the patients they can handle. In addition, the charge nurse really has to be quick to adapt to any emergencies and should always be flexible, not just being rigid to what has to be done. Why? Because at times during the shift, there may come up emergencies, and that's why Chadna should be able to jump in quickly, provide the guidance and leadership during the code, and be able to call in other providers to intervene. Having looked at the roles and the qualities of the charge nurse, it may sound like really a lot has to be going on in this position. And that's right. But at the same time, things don't go as planned. The charge nurse always has to encounter so many challenges. And that's why we should look at these challenges and see how one can overcome them to be able to serve well in the position of the charge nurse. Staff complaints, especially about assignments or sometimes refusing to complaining about patient admissions they receive may be one of the challenges the charge nurses may have to face. But by using the skills of great leadership and communication, charge nurse may be able to communicate the reason behind whatever decision that he or she made. Not having enough resources on the unit is another challenge. This is most especially related to the staffing when, for example, someone calls in sick and the charge nurse has to find a replacement. Um, the best solution to this would be for the charge nurse to prioritize and be able to make use of whatever resource that's available to achieve the goals of the unit. So we have looked at the roles of the charge nurse, the qualities of a good charge nurse, and the challenges, which where I also talked about the solutions to some of those challenges. The interesting thing is, if you are thinking of getting into the leadership or managerial role, the stepping stone may be being in the charge nurse role because this is where you gain a lot of skills that may allow you to succeed in the managerial leadership role. Therefore, if one, for example, floor nurse is interested in later getting into a leadership position, the first training ground may be getting into the charge nurse position because some of the skills you use in that position or the challenges you face are the same skills and challenges you may face when you are in the leadership position. These are my references. Thank you.